Very good morning to you. You're watching TV 47. I am Shiksha Arora and this is the Morning Cafe show. So right now we will be discussing matters health and we have a very crucial topic today, which is primary lymphoma of the bone. It is a very rare type of cancer, and with me in studio I have my guest who will be talking about this particular topic. I have Mr. Dr. Robert Mutengo, who is an oncologist. Thank you so much for coming on the show.
Thank you.
We appreciate you this morning, and we have Bakti Modi, a cancer survivor, who will be sharing her story. So thank you, Bakti, also for coming on the show. Remember, if you would like to be a part of this conversation, if you are a cancer patient, a cancer survivor, if you have any questions for Dr. Robert, please do feel free to WhatsApp us on 0795 045 864, or no, actually that's the call-in number. If you want to call us live on 0795 045 864, feel free to do so. You can also WhatsApp us and send in a message on 0793 267 279. Those are the numbers that you can reach us on. You can also find us on social media. The hashtag is Morning Cafe TV47. That is on Facebook. We are found at Facebook TV47 Kenya, and on X at TV47 News. I am at Shiksha Arora. Talk to me. You can also watch in live. Right, let's get to the conversation this morning. I am going to be starting off with you, Doc. Maybe you can just let the viewers know what exactly primary lymphoma of the bone really is, in the simplest of terms.
All right. Thank you so much for the invitation. So, primary bone lymphoma is one of the very rare subtypes of lymphoma. Basically, a lymphoma is a cancer that originates from the lymphatic system, where abnormal white blood cells proliferate or reproduce rapidly and grow and become a tumor. So there are two major classes of lymphomas: Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma primarily affects the lymph nodes. So you'll find a patient presenting with a large neck mass, the lymph nodes around the neck.
They're swollen.
Exactly, they swell, or in the armpits or in the groin, depending which nodes are affected. Then there's the non-Hodgkin lymphoma, which occurs, we call it extranodal disease. It occurs outside of the nodes. So it may affect the bone, maybe in the CNS, in the brain, maybe in the thymus, in the mediastinum, maybe in the abdomen or in the testicle, depending where it is. So that's basically how lymphoma is categorized. And bone lymphoma is one of the non-Hodgkin lymphoma, which affects now primarily the bone. The origin of it is from the bone, affecting major bones: the femur, the pelvis or the spine, sometimes the mandible as well, or the skull. That may happen as well.
Okay, thanks, Doc. Bakti, of course, is a cancer survivor, and we're very happy to report that you are cancer-free.
Yes, I am.
And that's so encouraging, such an inspiration. You know, Bakti has been sharing her story on social media time and again. She's been talking about how it's all in the mindset and how she was able to battle cancer, and of course, at the end, emerge victorious. So, Bakti, maybe you can start off by telling us how many years ago this was, and how did you discover that you had cancer?
All right. Thank you, Shiksha, for having me. I'm happy to share my story on this platform. Late 2022 is when I was diagnosed with the non-Hodgkin's primary bone lymphoma. As he mentioned, it's quite a rare and aggressive type of cancer. It took me 6 months to diagnosis, and I think just because of how rare it was, I was not able to get to diagnosis here. So I further went to India, and that's when they diagnosed me with this bone cancer. And unfortunately, at that point, it wasn't just battling cancer. I was bedridden for 6 months.
Wow.
And I was battling this, going through chemo, going through radiation. Just while being on my back, I was being taken, in ambulances. And it was quite a tough journey. Obviously, at that point, you feel like, time is frozen for me. Didn't expect.
Especially because you're young, you're active, you have a job, you have a career, you have a life. And then being bedridden for 6 months, that must have come as such a shock for you.
Yes, it definitely was. I think that was the hardest part of the journey, being bedridden for 6 months. The reason why I was bedridden was I had a pathological fracture. These sort of tumors actually do end up giving you a lot of fractures also. So I had like multiple fractures.
So your bone had
Yes.
kind of ruptured.
Yes, it had completely ruptured. It was
Wow.
broken. It was right at my hip joint. So this is an area where they're not able to cast or plaster. So they said the only way, and at that point we couldn't even already do a surgery. So they said the only way to, start the healing process is number one, the treatment, which is the chemo, second, radiation, and after that we'll see whether surgery will be required depending on how you're responding to the treatment.
Okay.
Yes.
Oh, that's a lot. Sorry that you had to go through all of that. Doc, have you seen many patients like Bakti here in Kenya? And how difficult is it to diagnose such a case? Because she did mention that 6 months she tried to get the diagnosis here in Kenya and it was almost impossible until going to India. Now that's when she was finally able to get that diagnosis that you have cancer.
Like I said earlier, bone lymphoma primarily is quite rare.
Yes.
I've not had any patient with primary bone lymphoma.
In Kenya?
In Kenya, I haven't met any yet.
Oh my.
But I have a few with lymphoma, rather with a non-Hodgkin lymphoma and with Hodgkin lymphoma.
Okay.
I currently have a patient who is on radiotherapy for CNS lymphoma. That is the disease that primarily started in the brain. Okay, so that's a bit more common than bone lymphoma. And like she mentioned, pathological fracture is almost always what makes the doctor realize this could be a bone lymphoma, because many of them will have had some pain, chronic pains that don't really go away on painkillers, and then the bone is eaten up gradually until at some point when the bone is weak and then just develops a fracture. Then that's when we realize, oh, this was something bigger than we thought it was.
Okay.
Yeah.
Okay. Now, Bakti, when you went to India and, once again, you had to go through multiple tests, you had to go and see multiple doctors as well. Maybe you can tell us how exactly they were able to pinpoint and how much time it took for them to realize and give you that diagnosis.
Okay. So when I got to India, that was actually on 30th of November. I got my diagnosis on 7th of December. So what they did was...
That's still a whole 8 days.
Yes. So even in India, I was actually the first case. They went into further research and told me you're actually the 5th case in the world that has battled the type of cancer that I have.
5th case in the world?
Yes, that's how rare this type of cancer. That's how rare this type of cancer is. And what they did was, obviously, in India they have like certain protocols that they follow. So they asked me. I had my entire history prior to when I met the doctors. We had a primary doctor who we knew we were going to visit, as soon as I land there. And he started ruling out. I gave him my entire history, and he said, like, what was your initial diagnosis? And I was like, I was told it's sciatica, which is a spinal-related issue.
Okay, and that's what you had been told that you had here in Kenya?
Yes, that's what I was told, that I have sciatica. Immediately, they told me, like, first of all, the amount of oral medications that you've taken, you wouldn't be able to take that anymore because it was quite strong painkillers. And after that, they started doing the MRIs, the scans, the X-rays, everything that was, and started ruling out everything that was related to the bone.
Right.
So they did also check my spine, and they said your spine is absolutely normal. So this is not sciatica. It has to be something deeper.
Okay.
And then they thought of, any bone-related infections. They thought it was arthritis. They thought it could be TB. So that's when they started ruling out everything. And I had a good team of doctors. I think there was not just one person, guiding me and trying to rule out everything. He actually brought in a good team of doctors who could brainstorm together and, figure out what exactly it is.
Okay.
And within 8 days, they told me, like, this is what it is. It's a tumor on your bone. And at this point, we don't know how long, like how much the cells have spread in your body. Oof. So only a PET scan was able to determine that. Okay. And hence I went for the PET scan. And I was very lucky, despite of how aggressive this cancer is, this type of cancer is, it was very localized and it had already spread 10 centimeters within the bone.
Okay.
Yes.
Okay. Wow. Doc, some of the things that patients go through, I understand, is pain. Bakti had severe pain and she wasn't able to walk. Obviously, the bone does get ruptured at some point. So these are a few symptoms that patients go through. What are other symptoms that, doctors are able to diagnose that this is actually primary lymphoma of the bone?
The common scenario, first of all, a doctor wouldn't suspect primary bone lymphoma.
Because it's so rare.
Yes. The common occurrence is metastatic disease to the bone, where you have a cancer elsewhere in the body, and then it spreads to the bone. So if I get a patient, or my colleague get a patient with a bone lesion or metastatic disease to the bone, I would first ask myself, what is the primary disease? I wouldn't think like the bone is the primary, you see. So I would go around trying to figure out where could this be coming from, you know, but at some point I will eventually have to make a diagnosis of a primary bone disease. Of course, with a biopsy.
Yes.
Yeah.
I actually did a biopsy where they pick a sample, they drilled into your bone, pick a sample, and then start doing different tests based on the samples that they've taken from the affected area.
Now, Doc, how long is the treatment for? Obviously, we'll also get to Bakti to talk about her experience, but you can also tell us how long the treatment usually lasts for. I know it definitely differs in each case. You know, every individual is different, but maybe on an average, you can highlight how long it lasts for and what the primary treatment is for this particular type of cancer.
Treatment could be from 3 to 6 months, thereabout. Usually we do chemotherapy,
of course,
and then radiotherapy. Surgery is not one of the primary treatments unless there's a fracture like she had. Sometimes, or rather most of the time, the patient responds quite well on chemotherapy. We're able to achieve complete remission. Then on your assessment after treatment, you may realize there's just one lesion that remains anywhere in the body, which you could treat with radiation. Then that would be the end of it. Unless now there's a fracture that comes up eventually in future that may warrant surgery.
Now, Bakti, you did mention that you needed hip replacement, right? So what was your first thought when you heard that, when you hear that you need a whole hip replacement, which is a massive surgery, especially for someone your age? Because usually we hear hip replacements are for the elderly, for seniors, for like 70 plus, you know, when their bones are fragile. So what did you feel when you were first told that the doctor said to you that, Bakti, you will need hip replacement to be able to walk?
At that particular point, I wasn't ready to hear about the hip replacement because it was already an overwhelming moment for me when I was diagnosed with cancer. So when you're diagnosed with cancer, you're given a treatment plan and you're told that, you know, you'll have to undergo these many chemos. In my case, it was 7, and then 25 radiotherapies. And after that, they said, you will have to get a hip replacement.
What's the difference? Wait, let me just stop you there. For someone watching who doesn't know the difference between chemotherapy and radiotherapy, maybe you can tell us that, Doc.
All right, so chemotherapy is medicine. I don't know how to, it's tablets, or it's an IV that is given into your brain.
It's an invasive person.
Yes. That's chemo. They are tablets, they are hormones, they're, you know, they are intravenously formulations. So all that is chemo. Then radiation is well, I don't know how to say it. It's non-invasive
less painful
way of you won't even feel that you're getting radiotherapy until after some time. You may, depending on the area of treatment, you may see some discoloration on the skin, or discoloration, or peeling off of the skin. Or you may also be experiencing some fatigue, nausea, and headache as you get radiotherapy. But the principle of radiotherapy is more or less like that of a CT scan. If you've ever gone through a CT scan machine, that's the same principle, really. You go in there, you lie on the couch, and then the radiation comes from, you know, from different corners, depending on how the machine is set up. Yes.
Right. So, Bakti, you mentioned 7 chemotherapies and 25 radiotherapies.
Yes.
And how long were these supposed to last for?
So my entire treatment lasted for 6 months. Chemo, radiation therapy, you can go every day and get the radiation done. So mine was Monday to Friday. Whereas in chemo, you actually have to give it a gap. And it's actually the most painful one because it's through an IV. I took mine through an IV. They inject a lot of heavy steroids in you, and that's when all the side effects come in.
Loss of hair, weakness.
There is a lot that comes in with chemotherapy. I think I would consider it as one of the most painful treatment one can ever go through. It's not easy to go through.
And not just physically, mentally as well. It takes a toll because you're seeing all these different changes in your body and your appearance and the way you feel as well. So maybe you can tell us a few things that changed. I'm sure there was hair loss at some point. And, you know, for us women, we love our hair. And I feel like this is one of the most traumatizing experiences. So maybe you can take us through that.
Yes. So before you start the treatment, the doctors will allow the patient and the guardians or your parents, whoever you are there with, to ask all the questions.
Okay.
And they actually have, like a counselor, they have a psychiatrist to just prepare you before you head in for this treatment.
Okay.
And they do take you through all the side effects, and obviously losing hair, losing your eyebrows, losing your lashes, going through that tiredness, having that nauseous feeling throughout,
Loss
weight
of appetite.
Yes, there's so much that comes with chemo. But at that point, you're like, okay, cancer is not going to define me. I'm not going to let cancer define me. It's not, it's just a part of my journey. It's not the end of my journey. I quickly prepared I had to change my mindset very quickly. It wasn't as easy as I'm making it sound today. Along with the patient, there's people around you who are also suffering. But these are the same people. Like, I feel like sometimes it's okay to make yourself very vulnerable to this kind of diagnosis. Ask for help. I obviously reached out to people, who've gone through similar battles.
Okay.
And there was a lot of positivity that came through. So I remember when I had to shave my head off, I didn't even want to look at myself, in the mirror, but I knew I had to get it done because it was more depressing being bedridden and just seeing like chunks of hair, fall on your pillow. So naturally, it's not like you just find yourself with a bald head. But when you start having this hair fall down, you automatically would want to just get your hair shaved. But the brighter side is that as we grow, especially as women, like you said, we're not that happy with the hair. So the doctor was like, you know what, the hair is going to grow back anyway. So these are the small victories. These are the small things that you look forward to, and just take things very positively. And that's exactly what I did.
Amazing, amazing. Doc, here in Kenya, when we have such rare forms of cancer, are we able to treat them in Kenya?
I think yes.
Yeah.
Very successfully we can.
Okay.
Yeah. It's not a one-man show. We always have tumor board meetings. Every institution has a tumor board meeting.
Okay.
Where we sit as oncologists, pathologists, surgeons, radiologists, all the staff involved in care for cancer patients. In our place, we meet every Friday afternoons. We discuss. Everyone brings their case and we discuss. We seek the opinion of others. So. Yeah,
wow, you work as a team.
Yes, we do. Yes, we do. So it is possible to be treated here. Only that she had a chance to go abroad and...
and of course, for someone who's not able to, they don't have the resources, then they have to stay in Kenya, and which is why it's very important to have the resources and, the technology that you need to treat such a rare form of cancer.
The only beauty probably for her was that there was no delay in the continuity of her care, you see.
Immediately, like, she went to India when you realized that this is not helping.
Yeah, however, before I got to diagnosis, it took me 6 months. And that's where the worry came into the doctors. Like, it's been 6 months to diagnosis. So
you'd rather just go?
Yeah, so we weren't sure at that point, like, how much of the cells have
been affected.
How much of my bone has been affected.
Okay.
Yeah, because the tricky part is the side it shouldn't go below your knee or above your waist.
Shouldn't cross the joint.
It shouldn't cross the joint. So I got very lucky that even though it took me 6 months to diagnosis,
it didn't spread.
Yes, it didn't spread. It was quite localized, and I got my hip replaced this year. Yes.
Oh, amazing! Congratulations.
Thank you.
And how's the recovery been for the hip replacement? Because we do know it's a huge, massive surgery.
Yes, it is. It's another painful surgery I got. There's a partial hip replacement and there's a full hip replacement. Unfortunately, in my case, the treatment did work. My bone fully fused. It's just the angle of the bone that changed, and the cartilage around the hip and the socket was pretty much worn out.
Yeah.
So they said this is creating like early stages of arthritis on your bone, and the best option for you is to get a hip replacement done.
Yeah.
So I'm good now. Yes, it's only been 4 months to my hip replacement, but I've been doing a lot of active physio, and that's really helping me.
Yeah.
Yes.
Yeah. Bakti, what are your thoughts about cancer care here in Kenya? Because we do know that it took you 6 months to diagnose. Did you ever go to an oncologist? Did you ever had that inclination where you felt like it is cancer or it could be cancer, or you are just, going for tests and going to meet this doctor and that doctor and that doctor until now you got to the point where you were just confused?
I didn't go to any oncologist.
Ever? You had no
not
idea?
in Kenya. No, I had no idea that this could be signs of cancer. I was completely clueless. But because my pain was so severe, I thought like, this has to be something more serious.
Describe the pain for us.
I would say it was a very sharp, stabbing, uncomfortable pain. Like as soon as you're walking throughout the day, there were days like I would be popping Panadols after every like half an hour. And eventually I upgraded on my painkillers. I remember walking into so many different pharmacies, you know, getting over-the-counter medicine, because I used to do a lot of kickboxing. I used to do a lot of dancing. I used to do a lot of gymming. So my first doubt was,
it's an injury.
Maybe it's a muscle. Maybe it's a muscle tear. Yes, exactly. And then I did a lot of detox therapies as well. So I had like three different doctors who told me that this is sciatica. And at that point, I remember I was like, I want to see how bad my spine is, even if this is sciatica and it's a slip disc issue. It's important that, you know, I just see how bad.
From the scans.
Yes, from the scans. But unfortunately, we didn't get through the scans, and then I consulted another doctor here, and he said this could be multiple muscle tears. So why don't you try out this medication? And if it doesn't work, then maybe you would want to see an orthopedic doctor. And that's exactly what I did. And finally, when the orthopedic doctor mentioned that this could be a hip joint related issue, I actually smiled, because I'm like, that's exactly where the pain is originating from. I did feel like something is like biting me, constantly nibbling, you know, into my bone, but I was not able to pinpoint that this is a bone-related issue.
You thought it could be a spine-related?
Yes, yeah. But I also, so what happens, I think, with tumors, and he can agree to that, is when you have a tumor in your body, you get like radiating pain. So even though the tumor was right at my hip, my back was constantly killing me.
Okay.
I was just getting severe headaches, and that's when I was like, this is something quite serious. And finally, the orthopedic doctor told me, like, let's just do an MRI for the hip joint. And I remember when I went to get my MRI done, even the radiologist was like, something very funny is happening with your bone. And it looks quite serious. And that's when we saw it was a hairline fracture. Though it was something, by the time I went to India, which was 2 weeks after my scan, it was more than just a hairline fracture, because I kept on putting a lot of weight. And then I was told it's osteomyelitis, which is again a type of bone infection.
You sound like a doctor yourself.
Oh yes, like, trust me.
Like when you're
through so much.
Yes, when you've been through so much, you end up knowing all these different terminologies, and you know, you become a textbook yourself, because you're constantly Googling and reading books, because you're just trying to figure out what is going on with my body.
Yeah, and I remember the orthopedic doctor said, like, you're an enigma, because we can't figure out what this problem is, and this could be a nerve-related issue.
Yeah.
And that's when I think my family and I decided, like, let's just, you know, go to India and try and see if somebody is able to diagnose this problem. And I understand, like, because I even asked all the doctors who I met here, and they said, we have never heard of such a case. So that's why it was also equally difficult for them to get to this kind of diagnosis.
Okay.
Yes.
Now, Doc, what is the survival rate for primary lymphoma of the bone, and what factors affect the prognosis? You know, when it comes to such a rare case, we do know that sometimes you hear a lot of cases where they haven't survived, they were not able to survive. And I actually call Bakti a miracle, because, you know, the fact that she's able to walk, she's able to lead a normal life in just less than 2 years of getting the disease, and, you know, being cured in less than a year. So it is quite a miracle. Also, mindset has a huge influence on your recovery rate. But maybe you can tell us, in terms of the statistics, what exactly is the... Yeah.
So many of the studies that have been done have basically been done on lymphoma in general.
Okay.
So I'll just put a blanket comment, and she will be inside, you know, covered in that, because bone lymphoma is part of the non-Hodgkin lymphoma, which is, you know, a subclass of that. So studies have shown that cure rates are very high for lymphoma. It's able to achieve cure. Up to 75% of patients can live up to 10 years.
Wow.
Yeah. So it's one of the cancers that can easily be curable.
Cured and treated.
Yes. It responds quite well to treatment.
Okay.
Yeah. And
if diagnosed in early stages, of course.
Yes, which is always the problem. Locally here, we have poor health-seeking behavior.
Yeah.
At least for you, you're able to get an MRI done within 5 months or so.
Yes.
Thereabout.
Yes.
ordinarily, like Kenyan wouldn't want to do an MRI, you know.
They would just think it's a back issue, muscle
Exactly,
pain.
and ignore and self-medicate until we have metastatic disease or a very big mass that has affected several other organs in the body, and then that's when someone seeks medical attention. Yeah, but in general, it is curable.
Amazing.
Yes. Yeah.
Okay. Now, Bakti, maybe you can tell us what your journey has been like. The past 2 years of your life obviously have been a complete game changer and eye-opener in the sense, you know, you haven't just changed physically, you've also changed mentally. You talk a lot about mindset, you talk a lot about, you know, being optimistic and positive. And maybe you can tell us how these changes in your lifestyle have influenced your recovery.
All right. Yes, like I mentioned earlier, being diagnosed with cancer, that's something so life-threatening.
Yeah.
It's not easy. It's not an easy journey for anyone. And even
course.
those who are battling cancer, it's they would be able to relate to me, like how disheartening, the sadness that comes, you know, within this, the trauma that comes.
For
There's a
you,
lot.
for your family, your loved
Yes.
ones, everyone.
Everyone is affected.
Yeah.
Everyone.
There's everyone, and at that point, you know, you're not sure, like, is this person going to survive, or is this treatment going to work for her? Is it not going to work for her? So, in terms of mental health, I will emphasize a lot on how mental health plays a big role, because when you get diagnosed with this, the first thing you have to find for yourself is a distraction. And just be super strong and be hopeful. Believe in your doctors, believe in the people around you. You know, smile if you have to. There are days that, you know, you feel like the light is dimming for you, but it doesn't mean it's the end of the world. Like, you have to understand that, okay, this will be like a little course I did, you know, I did for my body. And for me, mental health played a very crucial role. I did a lot of journaling. I did a lot of meditation. I spoke to so many of my friends and so many of my loved ones. A lot of people reached out to me who actually had, like, you know, where they had the cells spread all across the body, and yet they survived when they were told they barely even have chances to live. So having a strong mindset, when you're mentally strong, you know you're going to be able to physically battle this kind of diseases. So that's what I would really encourage for everyone. There's always hope. Do not lose that hope. I just posted yesterday that hope is a muscle. You know, you have to build that muscle for yourself. You can't, don't let this kind of thing put you down. There's always a treatment for any sort of these diseases, if caught at the right time. And yes, that's what I would say.
Yeah. In terms of how expensive it is financially, you know, I think that's a big factor that plays into how easily you recover, how quick you recover. Because if you have the money, then you can go to the best cancer institute, you can get treated immediately, and you can get the best care. Bakti, do you have an approximation of how much money it costs you to get through the entire treatment to date?
Wow, that's a good question. I was one of those lucky child that, you know, your parents don't even come to you and tell you, like, by the way, this is what your treatment is costing. But if I had to find an estimate from diagnosis till the end of my treatment, I'm sure it definitely costed us more than 2 or 3 M.
Wow, and that's
Completing
in rupees?
the whole, yes.
Which is like almost 5 million shillings if you do the math.
So that's an average.
Including the surgery?
No, not including the surgery.
The hip replacement surgery. And how much does that cost?
We paid about like 150 to 200,000 rupees with everything included.
That's like around 350,000 shillings.
Yeah, so that wasn't so bad.
So give or take 5 million shillings in total.
Yeah.
Wow. That's quite heavy.
Yes.
Locally, one cycle of chemo could cost around 120 to 150,000.
Wow.
That is every 3 weeks you're spending 150,000.
And then how
and
many?
it's not just chemo as well, right?
Yeah,
so in
of
my
course,
case, like
true.
after every cycle, they're doing like
There are lots of
multiple
other
blood
things that-
tests, there's
that we
multiple
do in
scans, multiple MRIs.
Yeah.
So there's all that comes, you know, with the medication after that, because it's not just chemo. You're taking a lot of like medication as well. Yeah.
Now, Doc, how well is the government equipped to cater for such cases, especially in public hospitals? You know, we've understood it is 5 million shillings. And if, for example, we had a case here in Kenya and they were not able to afford this private treatment in India, they would have to get treated here in Kenya. How exactly would the government be able to cater for such a cost in a public hospital?
Well, in the public hospital, NHF plays a big role.
Absolutely.
It helps quite a lot.
Yes.
To kind of pay for the treatment, the chemotherapy. But you'll realize also there are extra charges that come along that NHF cannot pay.
Yes.
So that's when the challenge comes in, because many of the patients cannot pay off pocket. Yes.
Yeah.
So you'll get someone on chemo, probably they do part of the chemo, not the complete chemo, because they can't afford some components of the chemo.
Yeah.
Like the rituximab, which is very important in this kind of cancer. It's an immunotherapy, which is quite costly. Not many patients can afford, so they'd rather just have part of it and omit one of the very important component of the chemo. Right?
And it is
so that affects outcome ultimately.
Yeah.
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 And also there are gaps in treatment. Someone will go off treatment for several,
Months.
yeah.
Because they can't afford it.
Yeah, you see.
Yeah.
So they come back again, tumor has regrown, it's, rapidly expanding and all that. So those are some of the challenges that we're experiencing. But in private sector, yes,
Of course, it's much
quite a lot can be done.
Yes.
Quite a lot can be done.
more advanced, I feel, here in Kenya as well. Bhakti, it's very important to have a really good support system, a community of friends and family who really just get you through this very difficult time, because as much as it's a difficult situation that you're going through personally, it's also for them. It affects everyone. What would you say, your family, how much did they influence the outcome of you being cancer-free? How supportive were they? Aside from being there for you financially, they also were there physically, because I do know you told me that they flew with you and they were taking care of you because you needed someone from your family there constantly. So your mom and dad were there at some point. They were taking shifts. Your partner was also there. So how did that play out for you?
I was a bit disappointed, I have to change the entire plan for my dad and for my mom, because they told me that, Bhakti, we're not going to move. So throughout my treatment, my mom and dad, they were constantly there.
They were there with you in India for 6 months?
Yes, they were there with me for 6 months.
Amazing.
They wouldn't even let me sleep alone. They were constantly making sure that, either, if not my mom, my dad is there. If not my dad, my mom is there. My mom fed me a lot of foods, because the doctor did mention, to my parents that one thing she'll be stubborn about is the food. Sometimes even when you just look at food, you just want to throw up the patient, and that's exactly what I went through. But my mom quickly, did her own research. She hid her pain away as well. It was quite emotional, for my mom and my dad. And
see what you're going through, the amount of pain that you're in.
Yes. And I think it was even heavier for them, because the day I was diagnosed was just 2 years to when I'd just lost my brother. So it was even more difficult for them.
Sorry for that.
Yes. And that's when I thought, I have to, if I go weak, my parents are going to be weak about this. And that's a voice, I heard a voice inside me and said, you know what, Bakti, do not let this thing kill you. It's you feel like you're in a ring, and there's cancer, and then there is you, and you want to live life. You have goals to achieve. You want to.
There's so much left because you're so young.
There's so much to live. You still want to live your life. You still want to make your parents proud. So yes, they were constantly there. It made a big difference in my life, just having them there. And as you mentioned, my partner would fly in. He actually lives in Uganda, so he used to take a flight every month just to come and see me, sometimes even twice in a month. I had situations between my chemo cycles where I got 3 emergencies in the middle of the night. I got a bacterial infection, I got a viral infection. I had a hot water bottle burst on my back, and the back was the only thing I was surviving on at that point.
Because you were bedridden.
I was, and bedridden to a state where I was not allowed to toss a turn on my right or my left.
What?
So you get a lot of bed sores, and you're
For
really
6 months you were
I was
lying
just on
flat.
my back. Yes.
Ooh.
And they gave me a rotation boot, which has a metal thing, metal plate, where your leg doesn't move, because they said the bone had already slightly displaced.
Okay.
So they said it's so weak, if that snaps, you're in for trouble, because that point, when you can't do a surgery right in the middle of chemo and radiation, you have to give a gap for each treatment. Yeah, so it was quite a tough one. But here I am, made it through life, and having your parents' strength, your belief in God, your belief, in the universe. I used a lot of law of attraction to battle this, and I was having a lot of conversations with the universe, and I said, no, I have to
You have to beat this.
Yes, I have to prove to everybody and to myself that I can definitely, like, you know, overcome this. And like you said, Bhakti is a miracle. That's exactly what the doctor said. To see your bone and they showed me on the X-rays, like, this is exactly what your bone was, and look at it now. So even for them, it was definitely a pure miracle. And that's exactly where you believe that your mindset does play a big role.
Yeah,
Yes.
yeah, amazing. Now, Doc, what are some of the long-term effects that survivors experience, you know, in terms of their recovery, even after recovering? I'm sure there's some changes in your body, how you feel, and what are some of these things that they experience long-term?
Yeah. But before I come to that, let me comment on the family support.
Yeah.
Yeah. So in this journey, family support is very, very important.
Absolutely.
Studies have shown that patients who have family support tend to do much better
wow.
than those that don't have family support. Because
Right.
you can imagine carrying the whole burden by yourself, figuring out where to get the money for the next chemo,
Yeah.
you know, what to cook for the kids are there for you and everything. I mean, they're waiting for you and all that is on your back. So that tends to weigh them down.
Mentally as well.
Yes, mentally, physically, emotional, and they are drained. They can't withstand treatment fully. Many of them will have to give them a chemo holiday, like breaks in between.
So that they
just
can
help
go
them.
and figure out life.
Yeah, but family support is very, very important.
Yeah.
And so to come to your question
Yes.
about the
Long-term effects.
long-term effects. So that is dependent on the stage of disease and what intervention was done to that person.
Okay.
So now, like for her, with a new hip, she'll have to learn how to live with that and how to manage. Maybe her gait has changed a bit. Her steps are not as before.
Yes.
So that's quite manageable. But there are those, imagine, who have gone for amputation. They can't get a prosthesis. They just have one limb. And depending which area of the body is affected, some have gone for mandibulectomy, where your lower jaw is removed. Like I know of one who lost the lower jaw because of that. And the whole face is disfigured.
Yeah.
So it depends really where the disease was and what intervention was done.
Okay.
Yeah.
Bhakti, maybe you can tell us from your personal experience, what are some of these long-term effects that you are currently experiencing, you know, that have changed your life in one way or the other?
Yes, there is a lot of body changes one goes through. I think each one has their own experience.
Yeah.
In my case, like, I do feel extreme exhaustions. You constantly...
And do you still work? Do you go to work?
No, at the moment, after my hip replacement, I didn't. But after my cancer treatment, within 2 months, I already...
Within 2 months, you went back to work?
I had to.
What?
Yes.
Were you able to walk at that point?
No, I was still using a crutch, but what happened was my leg shortened. So my leg actually became, my left leg became shorter by 2 mm.
And you had a bit of a limp?
Not even a bit, quite a visible limp. And that was really putting a lot of, like, my right leg started compensating.
Yeah.
And obviously your knees are hurting. You know, you're, like you said, you can't be that active person you are before you go through this, you know, you go through something like cancer. So it's something you just have to then live with, and, you know, you can't let life stop just because, you know, you're feeling exhausted. But and you go through a lot of brain fog as well. So that's one of, you know, that's something else that I'm going through as well. You experience a lot of brain fog. There's a lot of fatigue in your body, your muscle pain, your joint pains. So I think those are the most common things in everyone after cancer. And that's something that probably just, it could stay with you for a lifetime. Yeah.
Wow, this is quite, you know, you never really realize the effect that it has on one until you hear from a person who has gone through it. And you're a living example of somebody who has experienced all these different changes, from having like a completely active lifestyle. You said you were kickboxing and dancing and all of these things, and then now to being bedridden, and then now slowly figuring out how to adapt to this new change that you have currently gone through and this new person that you are, because it just makes you a new person.
It really
right?
does. It reshapes your entire life, feels completely reshaped.
Yeah.
And then after this is when you start, like, you know, looking at like the entire perspective of life so differently. Like when you're waking up, or even when you're driving around, or, you know, doing anything, you feel like you're holding a bag of gratitude and hope with you.
Yeah.
You know, which was not the case before. So
you look at things differently.
You appreciate the smallest of things in life. And I think, like, you know, it's quite a positive, because you start even tackling, remember, the cancer is not the end of anyone's journey. It doesn't mean if you have cancer, you won't get diagnosed with other kind of things.
Yeah.
As we age comes a lot of like different changes in the body. So that's when you start learning how to accept, like, okay, you know what, I've gone through this, so I can easily overcome this kind of.
And having that attitude is very, very important.
Yes, yes. You're always ready for the worst.
Yeah, sure. And because the diagnosis of cancer is not the end of life.
Exactly.
You know, life has to continue. Like I usually tell my patients, once you get your chemo, after 2 or 3 days, when the symptoms wear off, go to office, go to the mall, do stuff,
you know,
do house chores, do everything that you used to do before. You see, because life has to continue.
Yeah, and you really learn how to, like, you know, acknowledge all your fears in life as well. So yes, I do feel like a complete different person. Even this is a time where you don't realize yourself how much strength you're holding, you know, you're holding within you. It's only these kind of challenges that show you that I can really
just monitor the current situation.
Yeah. So first of all, usually we want to enroll the patient into a support group.
Okay.
So you find a group of survivors with similar cancer. So you enroll in that group so that you're able to, you know, to be motivated and to have a positive attitude and all that, to be able to go through the treatment. Then after that, like now she's in the maintenance phase rather than the follow-up phase.
Yeah.
Usually you have to see them every 3 months. They come to the clinic. Yes, every 3 months. For the next 2 years, they come to the clinic for review. Even when they have no symptoms, they just have to walk in.
Still need to come.
Yes, yes.
Okay.
And at some point, we may need to do CT scans or MRI, depending on the disease and the stage that it was treated before. So every 3 months, you come for review with an MRI scan or CT scan, or just come for physical examination and all that for 2 years. Then after that, every 6 months for 3 years.
Okay.
So that makes 5 years in total.
Yeah.
Then after that, annually for life.
Okay.
Yeah. So you really never go away like forever. You really still have to stick with your doctor all the time.
There's always this anxiety. That's what I call it. It's this anxiety, because you don't know, like, you know, every time. I'm actually due for my scan next month, and now I'm not only checking for the cells, you also, you know, there's a hip joint scan that you have to.
And that is very important, because the problem with cancer all over the world is recurrency. Someone will be cured for 8 years, 15 years, then later the cancer comes back. So it is important to stick to your doctor for close follow-up, just to be sure when there's any recurrence at any point, it is picked early enough and it is sorted early enough.
Yeah.
That is the point.
Okay.
Yeah.
Bhakti, what are some of the changes you've made to your lifestyle in terms of nutrition, in terms of how you live, just to adapt to this, you know, new situation and new treatment and just basically a whole new chapter of your life? So in terms of the food you eat, in terms of your habits, drinking, smoking, going out, all of these things, how have you adapted to them?
So after this, life teaches you that, you know, and the doctors will tell you, and we don't know what causes cancer. It's very, especially in my case, the first question is what could have caused, you know, what could have caused cancer? What they tell you is that we can't pinpoint what caused cancer, but what you can change is your diet, your activity, and your lifestyle. These are the three things that boils down to just living life in moderation. So enjoy, live life. You know, we don't want to tell you don't eat sugars, don't do this, don't do that. But do it in moderation, whatever you have to do. Like, don't overexert yourself, even if you want to go out. Like, if you were a person who was going out like every weekend.
Will you have a drink once in a while?
Yes, I would. I would have a drink once in a while, because these are all the questions I'd already, you know, asked the doctors if it's safe to do so. So that's when they'll tell you, if you're a person who's having like 4 or 5 drinks, it's okay. Like, you can have a glass of wine, but then, you know, don't
make it a habit.
Don't make it a habit. So I have changed a lot in my diet as well, not drastically, because like I said, I still want to live life. It kind of depresses you when you deprive yourself of things that you like. You know, I really enjoy eating out, so I slowly, like, I took a gap for about 1 year of not doing any of, you know, not eating any of the junk, because there's always that fear in your mind, like, I've just battled this, so let me eat as healthy as possible. But then down the line, you meet people who have never drank, who have never smoked, who don't eat junk food, and who end up, you know, who are like fitness trainers, and then they end up getting diagnosed, you know, with cancer. So that's when you're like, okay, you know what, I'll strike a balance in my life and do whatever you're doing, but in a very limited moderation. Moderately, basically.
Okay. Doc, you know, some of the challenges that cancer patients and cancer survivors go through is stigma. People usually believe that once you have cancer, you're going to die. Period. Like there's no other outcome. And we see this on social media as well.
Yeah.
And then usually there's that sympathy that comes and pity, and constantly like you feel like people, they've changed the way they look at you, they've changed the way they talk to you. Even people that you knew really well and your friends and family sometimes, and you have to remind them that, listen, stop being negative, please be positive, because I am going to overcome this. You also have to have that mindset to be able to encourage and also keep reminding the people around you to keep being positive, because it's so easy to lose faith and hope, and I feel like it's a constant reminder that we need to be optimistic. So Doc, what are some of the things that you'd like to tell family members and loved ones on how to approach a cancer patient or a survivor, and how to just make sure that the conversation is very positive and, you know, they don't look at you as a beacon of sympathy?
See, that is the unfortunate part about this disease.
Yeah.
And the community that we live in. Social media, I don't know, should I say social media or the world has taught everyone to believe that once someone has cancer, that's
the end.
You know, but there's actually life beyond cancer. I have some of my patients who are going through this treatment by themselves. Their spouse is not aware. None of their children know.
What?
Yes, they come by themselves.
Wow.
Because of the stigma they try to avoid.
Because they're scared that maybe my spouse will leave
yesterday,
me.
I had a gentleman of 38 years old.
Yeah.
For whom we finished his treatment yesterday, and the wife is not aware what the husband is being treated for.
What?
For the last 25 days of radiotherapy, he's been coming to. He comes from Kisumu. He's been coming to Nairobi for treatment. Wife is not aware. Absolutely, she knows that the husband is in Nairobi for treatment.
Why though? What's the reason
For stigma.
behind?
Because he told me yesterday, once his wife realizes that this is cancer, she will leave him.
What?
You see, so
It's true. That does happen.
That's how serious this issue is.
Yeah.
And so you see, for such patients, they tend not to do quite well because already they're stigmatized in themselves. They are hiding from everyone.
Yeah.
They are withdrawing from things they used to do before.
Yeah.
And so this really weighs them down. And they come down with so many side effects and complications and all that. But if
autoimmune diseases.
you see, but if you speak out, you let your spouse help you, make for you the foods you want to eat, when you're feeling low, she understands, that kind of a thing.
Yes.
That helps a lot.
It does.
It helps quite a lot.
Yeah, it plays quite a big role.
Support is everything, really. I feel like at the end of the day, if you don't have a good support system, then it's always going to be an issue, and you will feel like it's the end of the world, basically.
Yeah, for sure.
Bhakti, as we wrap up, what would you like to tell somebody who's watching, who is going through cancer, who has a family member or a loved one who's also a cancer patient or a cancer survivor?
To anyone battling cancer out there, it's not the end of the world. Please do not lose hope. Like he said, do reach out. It makes a big difference. It made a big difference in my life, just having a very good community around, having your friends, having your relatives who come and visit you. So please do talk about it. I'm also here, there's a lot of people who've been reaching out to me.
Yeah.
And I'm here to guide. Like, I wouldn't be able to diagnose or give you medication for it, but at least I will share the same strength that I held, and we're all here for you. And just don't lose hope is what I would say to all the patients. Like you still, there's so much more to life, and cancer is not even about age groups anymore. Like when I went to India, I saw people who, like kids who were about like 8, 9, 10, 11 years old, who have lost their entire leg. And, if they can battle this with a smile on their faces, you can too.
Yeah.
Yeah.
Yeah. And what about you, Doc? What advice do you have for patients, for family members, people who are watching this, who really feel like it's not possible to win and to conquer the disease?
I like how she put it. She said, it's just a phase in life you're going through. It's not the end of your life.
Yeah.
So there's life beyond cancer.
Yeah.
I personally have several success stories of patients I have personally treated.
Amazing.
That have been cured, and I've met others. Like this one young man, well, not so young. He's a university lecturer at Nairobi University. He was diagnosed with cancer 12 years ago, even before I went to medical school, and now he is my patient and is doing quite well. There's another lady She was diagnosed when she was 55 with breast, and now she's 82,
Wow.
alive and well.
Almost 30 years.
Yes, yes. So this is a journey that you can win. It's not the end of life. Once you have been diagnosed with cancer, seek help, speak out, reach out to people who can help you. Come out, openly, and let's see what we can do for you,
Yeah.
to restore back your health.
Okay, amazing. All right. And I think that brings us to the end of this conversation. Thank you so much for being on the show today. I really appreciate, your time and presence. I feel like this is a topic that we need to have more conversations about, speak to survivors and just share people's stories, especially success stories. Because as I said, the stigma that comes with being a cancer patient, I feel like it is one of the biggest in the country, not just country, but globally. People don't really know how to deal with cancer patients, how to act around them, how to talk to them. And I feel like these are things that you need to educate the youth, the young people,
Everyone.
in fact, people of all ages.
Everyone
It doesn't matter, as she said, cancer is not really an age-related thing. It could happen to anybody. So if you're watching and you have somebody who has gone through cancer, just know it's not the end of the world.
Yeah.
If you're a cancer patient, I'm sure Doc and Bakti have given you the hope that you need to just go through with the treatment and just know that there's life after cancer. Thank you so much for watching. I've had an amazing session right here. This is the Morning Cafe Show. You're watching TV 47. I am Shiksha Arora. We'll come back next week with some more interesting topics for you to be able to learn and just get some education, as also inspiration about right here on this particular